Hello, everyone. Today, I'm going to talk about exploring the multimodal approach to lower face contouring. And my talk is the last one. Create an ideal facial contour. The outer contour needs to show a smooth single convexity, and the inner contour needs to show a gentle OG curve. And how to look young and vivid. Basically, it is essential to have smooth and convex cheeks and well-defined jawline to look young and vivid. What about men? Men should have a sharp jawline, but a stiff chin as well. Since there are some differences between men and women's ideal lower facial shape, we need to consider about these differences when planning lower facial contouring. From the lateral view, the rickets line could be used as a guideline for creating an ideal profile. However, I'm applying a more alleviated standard of rickets line for Asian patients due to the ethnic difference. For example, the tip of the lower lip does not have to be behind the line, and it's fine as long as it does not cross the line. These are contents of my today's talk, and let's talk about anatomical considerations in lower facial contouring first. When we get older, the jawline gets distorted as the jowl fat emerges. At the same time, the melomental folds or Marriott lines appear. In an article published in 2022, the anatomy of the jowl and the mandibular ligament was described precisely. The location of perioral muscles, facial artery and vein, and marginal mandibular nerve. I found some interesting things in this article about the Marriott line or labiomandibular fold. We can divide into upper and lower part of the labiomandibular crease or fold. In the upper part, retinacular cutis fibers connecting to the dermis to the muscle are quite long in the cheek area. However, these are abruptly shortened over the lateral to the DAO and become almost absent to medial to the DAO. So we need to know that there is an abrupt change from the labiomandibular crease. So and Professor Han has also already mentioned about it. So the skin quality is different, and inside the skin, the sub-Q conditions are also different. However, in the lower part, the differences is less than upper part. But inside the skin, lateral to this crease, the sub-Q fat allows mobility of skin over the muscle, so it's quite soft when touching. However, the medial to the crease, the skin and mimetic muscles are adherent and moves as one entity, so it's more dense when touching and pinching. So this is very important clinically because when we use a thread to improve the jowl fat sagging, we sometimes advance the thread and across the labiomandibular crease. But this may cause some side effects such as skin dimpling or skin surface undulation irregularities because of these different quality or conditions of the skin tissue. So I would recommend to put thread not beyond the labiomandibular crease, but we need to stop before this crease. Another important structure is the parietic gland when planning the low face contouring. Because when we put threads to lift the low face, we need to position the thread over this gland. So we need to advance our threads very carefully, not to go underneath the smas. And when lifting the submental area, we also need to carefully advance the thread because there's submandibular glands. Now I will briefly talk about the product, Epitic filler and Epiticon thread. Epitic is made of high quality HA raw material without endotoxin. and it is minimized output and residual amount of BDDE. And this technique enabled a very low MOD value that results in ensuring safety from a very low incidence of immunologic reactions after epitic injection. That is possible due to the ZEEP technology, a unique one from Jetema. An epitic filler has a MOD of 1% in all three of the three SKU. These numbers are significantly lower than other fillers and have a lower MOD than those of biphasic fillers. Not only that, in terms of the rheological property, epitic filler has a high cohesiveness that is strongly related to the lifting capacity. Thanks to this high cohesiveness, epitic filler is not easily pressed or crushed even if a vertical external force is applied to the injected area. Eventually, the injected filler can maintain its original shape for a long time. Also, it allows excellent molding and extrusion force by making homogeneous and fine particles through the downing process. These are summarized strong points of EpiTQ. Now let's move on to Epiticon. It has three different types with different mode of actions. First, Epiticon Original. It has a unique shape of cogs that have both pulling part and fixing part in one single unit. They just look like barbs from a wire fence. There are three differential points or strong points of Epiticon from other conventional cog threads. First, Epiticon has a powerful tensile strength and barb holding strength due to a constant thickness of whole thread and excellent durability of the cogs. Second, there is much less risk of skin dimplings or unevenness after treatment. Epiticon has a zigzag pattern of the cogs that enables a wider dispersion of mechanical stress that is usually concentrated on a small part of the cogs in other conventional bidirectional cog threads. Eventually, discomfort or skin unevenness after Epiticon insertion can be prevented. The third differential point is that there is no early relapse. In general, when a conventional bidirectional cog thread breaks after insertion into the skin, it instantly loses its ability to hold tissue, resulting in an early relapse of sagging, skin sagging. However, Epiticon can continue to hold the tissue as a small unit, even if the thread breaks in the middle. So this small unit is playing a role by themselves, and even though the thread is broken, there will be no early relapse or skin sagging. And Epiticon Bi is the same features as Epiticon Original, but the different shape of cogs. This Epiticon Bi is bidirectional cog thread. And the third one is Epiticon Chamber, which I like the most. It's my favorite product because Epiticon Chamber is a spring-type PDO thread coiled on a blunt cannula. And once it is inserted into the subcu fat layer, neocollagenesis occurs inside and outside from the spring structure. Eventually, these collagen columns form a scaffold supporting the skin tissue and tightening the skin through dermal remodeling. So it is commonly called a solid filler. Usually, I like this product to put infraorbital hollow, especially when skin laxity is combined. And where the filler do not work well, you can think about using this Epiticon Chamber. Why Epiticon? Why we need to choose Epiticon? Epiticon provides ease of use, low side effects, and long-lasting results. Now I will talk about low facial contouring technique, injection and insertion of fillers and threads. When lifting the low face, usually the jaw fat and submental fat are targeted. And we need to choose the right vectors. These are proper and appropriate vectors. So I usually use 3 entry points for the jaw fat because jaw fat is very difficult to be lifted up. So if the jaw sagging is severe, we need more entry points. So I usually use these 3 entry points. And for the more vertical vectors, I use Epiticon bi, and for the horizontal vectors parallel to the jawline, I usually use Epiticon original. And for the submental area, when we lift up the submental fat to reshape or tighten the submental skin, then directly the neck can also be somewhat lifted up. So when we target the submentum, we can expect that the neck lifting effect will be combined after the treatment. For this submental reshaping, I use this hammock technique. So entering from the midline, a minimum 3, sometimes 4, and I put Epiticon bi to both directions and I tie up in the middle. So I'll show you this technique in the video. And when it comes to filler injections, if the chin is a little blunt and you want to give a slight volume or just creating a pointed chin, then it is more effective to inject the filler using a sharp needle. Injecting into the supraperiosteal plane on the midline about half ml and 2 or 3 more points surrounding this first point. And usually the total amount is 1 ml or less. And I use Epitic 500 because it has highest G prime. However, if the patient's chin is too retracted or too small, then a blunt cannula may be more useful because in most of these cases, it's necessary to inject quite a large amount of filler, 1.5 or 2, sometimes more than 2 ml, into multiple layers with fanning or cross-hatching techniques. I prefer to use 22G cannula because it's quite stiff and I can advance it relatively easily into the depths I want. And for patients with very small chin, I use up to 2 ml of Epitic 500 into subdermal and underneath the muscle, into everywhere in the chin to make very smooth contour dome-shaped elevation. And sometimes we need to check with other surrounding adjacent tissues. So if necessary, you need to inject into prejowl sulcus to create smoother jawline. And marionette lines, I use both 300 and 100. And when using 300, I mostly use a blunt cannula. And when using 100, I prefer to use 29 to 30G needle, injecting into subdermal plane. And it depends on how deep is the line or fold. Usually the sharp lines easily corrected by sharp needle using 100. Sometimes I inject 0.2 only per side. And jawline is also a frequently targeted area to create more defined jawline. However, in Asian countries, especially in Korea, very low people are targeted because people don't want to widen their mandibular angle. So I would recommend to combine with thread lifting and use the filler, the least amount of filler to make the jawline. And then patients will be satisfied. And of course, botulinum toxin injection is very important when contouring the low face. However, we need to pay attention because if injected asymmetrically or in a wrong place, wrong plane, then asymmetric smiles may happen. So it's better to inject very symmetrically and very precise locations. And usually these 3 muscles are very strong mouth corner depressors. So by relaxing these muscles, you can create uplifted mouth corners and jawline lifting. I'll show you some before and after photo. She had already good chin, but she wanted more pointed chin. So I used only 1 ml of Epitic 500 by using sharp needle. And more retracted chin, I will need more amount of Epitic 500. And since the Epitic 500 has quite high G prime and high powerful lifting capacity, you can create good projection of the chin. And recessed chin or almost nose chin. For these patients, I use 2 ml or sometimes more than 2 ml, and the injected area will be larger than usual. So I will also show it in my video. And sometimes when deciding jawline or chin projection, then we need to see not only the chin, but also the chin border or jawline, because we need to create more harmonized or balanced jawline with a chin projection. So for this patient, not only the chin apex, but also into the jawline, very close to the chin, I injected these 3 areas to create smoother jawline and the chin contour. And she was young, but she wanted to have more defined jawline, so I used Epidicon Original and Bi to create more sharpening of the jawline. And when using Epidicon and Epitic filler at the same time, you can create not only well-balanced volumizing effect, but also quite good lifting effect as well. She's also had both products at the same time, and the result was excellent because this result looks more natural than before. First, I designed heels and valleys. Usually the jowl fat will be the heel part, and the above this jowl fat, usually there are a slightly sunken area. And I designed 6 Epidicon Original per side to create the jawline definition and jaw sagging improvement. And also for the submental area, I planed 6 Epidicon Bi. And now I'm injecting lidocaine, and since I will inject filler, epitic filler into the chin, I block the nerve, mental nerve. And this lidocaine is containing epinephrine to prevent severe bleeding at the entry points. After inserting 18G needle for skin puncture, I infuse some tumescent. This tumescent should not be too excess. 3 to 5 ml per side is usually enough. So it's for pain relief, reduction of the pain, and creating some space, especially when soft tissue has quite high fibrotic changes. And now I'm inserting Epidicon Original with the cannula connected to cannula. The size is 19G. It's really useful because this thread and this cannula, the length is very optimal for this horizontal insertion, because normally most cock threads have 10 centimeters length. It's too long for these vectors. However, Epidicon is shorter than 10 centimeters, and I think it's quite optimal. Inserting into 2 entry points. Each entry point, I'm inserting 3 threads with same ending points. It's very easy to design, and this ending point is just laterally located to the Marriott line. Some clinicians are inserting across the line, but you need to be very careful, since I already mentioned that the thread may enter into oral cavity, or if the thread's end is positioned too close to the dermis, you may create some skin dimples. So I like this fixed type threads because there's much less undulations or irregularity after insertion. So for especially young patients, I would recommend to use this fixed type Epidicon Original. To be honest, instead of lifting, it's just tightening and make skin more tightened. So the result is quite good. And for the submental reshaping, I'm making 3 entry points. These 3 entry points should be located within the inferior border of the mandible bone and above the hyoid bone. And also these 3 epithecon bi-threads have the same ending point, which is usually very close to the earlobe, 2 to 3 centimeters below the earlobe. And I insert it into both sides using the same entry point. And another epithecon bi is inserted. When removing the cannula, you need to hold the skin and lift up towards the entry point. And after fully inserted the threads, I am tying 2 threads. Usually I tie 2 knots, and the knot should be very firmly tied. And after cutting, by pinching the skin, you can easily make the knot go inside the skin. If it's not working, you can use the forceps to lift up the skin, to separate the skin from the knot. It's much better than inserting threads from the lateral part toward the medial part, because usually when entering the lateral to medial vectors, the longevity is quite short. However, this method, you can expect more than 6 months of maintaining good results. And since she had quite small chin and her central mandible bone showed some hypoplasia, so I plan to inject filler not only on the midline but also for the lateral part of the chin and Merit line. So I injected more than 2 ml, 2.5 ml. And when injecting the filler from this entry point, you need to inject not only into deep layer but also superficial layer, multiple layers. And the Merit line, more amount close to the lips and less amount close to the entry point. So you need to create a cylinder that has large amount on the distal part. And after full injection, she had a nice contour. So this is right after. We can already see that the submental area is quite reshaped, and her chin and jawline look more defined. Okay, now I will talk about the conclusion before wrapping up my lecture. Therapeutic approach for lower facial contouring should be customized for each patient because everyone has different skin conditions, different sagging degree, and different jawline distortion degree. And it's very important to evaluate the dynamic movement of mimic muscle. So we need to see the patients not in a resting, not only the resting position, but also smiling, moving, expressing their mimic muscles. And we need to see if there are some asymmetric movements or different condition from the resting status. And multimodal approach is the key to achieve balanced outcomes of low facial contouring in a very natural way. Other than that, we can use HIFU or other energy-based devices or skin boosters may be helpful to achieve better results. And it is necessary to choose highly qualified PDO threads such as Epidicon and rheologically well-balanced contouring filler, just like Epitic filler. Thank you very much.